All right. Good afternoon, everyone. Sorry to those of you who've got sort of my back to you, but my name is Ashish Shah. I'm the White House COVID-19 Response Coordinator. And welcome to the White House. Welcome to our summit on indoor air quality. Now, for many people, this may seem like a narrow topic, indoor air quality. But for people who've been paying attention for the last 2.5 years, and certainly for people in this room, you all know that this is neither narrow nor a side issue. It is absolutely critical if we're going to think about improving public health in America, improving public health in the world. Indoor air quality's got to be at the top of that agenda. Now, I'm a physician, and the way I have thought about this topic, there are many of you who are engineers and scientists and aerosol scientists and people who've been thinking about these topics for many, many years. As a physician, I think about the fact that for nearly the entire existence of humanity, pathogens have infected us in several key ways. Among them, most significant, the water we drink, the air we breathe, right? Those have been two major modes. And if you look at water, and you start with water, lack of clean drinking water has meant that people just got sick repeatedly, over and over again. People died in large numbers from gastrointestinal pathogens. It was just simply part of the human condition, just what we accepted. But over centuries, we learned that we can actually do something about this. With sanitation came massive improvements in water quality. Not a single event or a single step, though there are some single events, right, that have gotten a lot of attention throughout history, like the cholera outbreak in England, where John Snow mapped out the outbreak and got rid of the handle on the Broad Street pump and single-handedly changed the course of that cholera outbreak in London. But here's the key lesson as I have thought about the efforts to improve efforts to improve water quality. We learned that you could, of course, boil your water and make it safer. But the policy solution was not everybody should boil their water all the time. No, fundamentally, the reason it is safe to open up a tap in most places, not everywhere, and we're still working on that, but the reason it is safe is because we made a set of policy decisions as a country, as a world, that water needed to be safe, and there needed to be systematic engineering efforts to make water safe for people to consume. It was an institutionalized change, did not require active behavior on part of people. You didn't have to think about, as you opened up the water, is this safe or not? Now, obviously, there's still more work to do, and that's why the administration has made, for instance, replacing lead pipes a centerpiece of the bipartisan infrastructure law, where we're going to replace all the lead pipes in the country over the next decade. So my point is, even when you look at something like water, where we've made so much progress, you're constantly working on it, continuing to make efforts. But we've come a long way because of systemic fixes, possible in large part by advancements in science and advancements in policy. Now, in my mind, indoor air is that next frontier when it comes to thinking about public health for humanity. Now, obviously, outdoor air pollution is incredibly important and, of course, influences indoor air. But today, we're going to focus on indoor air quality. So one of the things I learned early on in my public health career was that most Americans, really obvious, but you don't think about it if you're not in this field, most Americans spend most of their time indoors, right? We all spend about 90% of our time indoors. Here we are, all of us today, indoors. Actually, on Twitter, somebody was saying, this indoor air quality summit, are you going to hold it outdoors? Like, no, it's an indoor air quality summit. We're going to figure out how to make it relatively safe indoors, which we have. Tall ceilings. Most of us have gotten tested today. We've got air filters and air purifiers. But the bottom line is that we know respiratory pathogens like flu and RSV, and yes, SARS-CoV-2, spreads mostly indoors. And this once-in-a-century pandemic has given us a moment, right? A moment where we can drive significant structural changes in the air that we all breathe. We have to bring the burden of respiratory pathogens down. And the single biggest structural change that we can make as a society is to do for indoor air what we've done for water quality. And that's why this administration has made improving indoor air quality a key priority. Whether it's in schools or businesses or other public places, and as I have said publicly many, many times, if you are somebody who runs a building, operates a building, it is incumbent on you to make sure that the place you run, the place you own, does not become a place that unnecessarily spreads viruses, gets people sick, fills up our hospitals, causes unnecessary suffering and death. We've made strides in helping schools improve ventilation and filtration. Right? The American Rescue Plan has allocated hundreds of billions of dollars. And today, nearly half of school districts have committed to using ARP funds to improve ventilation. Obviously, we want to keep driving that to higher and higher numbers, but that's been a really important thing. So, bottom line, we are pushing across a whole set of issues, working to drive improvements. Because while I've talked about indoor air quality as an important thing for public health, for school performance, for all sorts of respiratory pathogens, my day job is as a COVID response coordinator to think about how do we manage COVID. And what we know is still have hundreds of Americans dying every day of this virus. We've got to work on vaccines, we've got to work on treatments, we've got to make sure testing is available, we're doing all of that. But we've got to make improvements in indoor air quality as part of our response to COVID, as part of our response to respiratory pathogens all around. So let me turn it over now to my colleague and friend Joe Allen, who's an associate professor at the Harvard School of Public Health, director of the Healthy Buildings Initiative, somebody who's taught me a lot over the years about how to think about indoor air quality. Dr. Allen, thank you.
Good afternoon. All right. Dr. John mentioned we spend 90% of our time indoors. I'm going to ask you to think about it another way. Take your age and multiply it by 0.9. That's how many years you've lived indoors, your indoor age. I'm 47. I've spent 42 years of my life indoors, in homes, apartments, schools, airplanes, trains, buses. Think of it this way, it becomes obvious and intuitive that the indoor environment has an outsized impact on our health. So much so that, as I mentioned at an event Ashish hosted a few years ago at Harvard, the person who manages your building has a greater impact on your health than your doctor. Think about that. The original sin in the COVID response was the failure to recognize airborne transmission as the dominant mode of transmission. In addition to decades of science showing better ventilation associated with reduced spread of respiratory viruses, the early clues during COVID were obvious. Nearly all spread indoors in underventilated spaces, and super spreading events with 90% attack rates that could not possibly be explained by droplet transmission or everyone touching the same elevator button. The case for airborne transmission is airtight. This means that buildings should be the first line of defense. This wouldn't be a problem, except for the fact that we haven't designed and operated our buildings with health or respiratory infection control as the goal. Instead, we've had standards that target bare minimum ventilation rates, like the ASHRAE standard, ventilation for acceptable indoor air quality. Acceptable is not acceptable. These standards have led us to seal up our buildings, choke off the air supply, despite decades of science showing us that current ventilation rates are too low. Not only are the ventilation standards too low, but performance drops over time too. A school might be designed for 3 air changes per hour, but on average, schools get about half of that. And we see even lower ventilation rates in schools with majority Black or Hispanic populations, and lower ventilation rates in schools with majority of students on free or reduced lunch. Healthy buildings are at the nexus of COVID, health, equity, climate, and business. I'm going to make a series of recommendations. On COVID, to address COVID and other infectious diseases, it's imperative we think of buildings as central to our fight. We released a report called The First 4 Healthy Building Strategies that every building should pursue. Number 1, give your building a tune-up. We do this for our cars, we don't do it for our buildings. It improves indoor air quality and saves money. 2, maximize outdoor air ventilation. 3, upgrade filtration. We need to move away from filters designed to protect equipment to filters designed to protect people. MERV 13 is the new minimum. And we can supplement this with portable air cleaners. This is not the end-all list, but this is where you should start. We can take the pulse of our buildings using lower cost indoor air quality sensors that measure things like CO2, a proxy for ventilation rate. Indoor air quality monitoring should become the norm in every building, much like we measure temperature. Seeing an IAQ monitor on the wall should become as normal as seeing a thermostat. On climate, we must ensure that these healthy building strategies like enhanced ventilation and enhanced filtration are not at odds with our climate goals. Buildings consume 40% of global energy. In some cities, it's 70%. In response to the global energy crisis in the 70s, many tightened up their building envelopes to conserve energy, ushering in the sick building era. Energy efficiency at the expense of indoor health is a false choice. We can and must have both. We need to deploy existing and readily available technologies in our buildings to ensure healthy IAQ while reducing energy demand. energy recovery ventilation, air source and ground source heat pumps, drawing electricity from renewable sources, and demand control ventilation, using air quality sensors to deliver air when and where it's needed. Put all this together, the COVID benefits, the health benefits, the equity benefits, the climate benefits, the business benefits. It becomes quite clear there's no reason not to improve indoor air quality in our buildings. Now that the world has experienced COVID, healthy buildings are no longer nice to have, they're the new minimum.
So as Dr. Allen said, my name is Tracy Washington Anger, and I have had the privilege this last almost 30 years of working with the U.S. Environmental Protection Agency's Indoor Environments Division, and the joy and the vocation of my life has been in promoting our indoor air quality Tools for Schools guidance kit to help schools across the country put in place comprehensive indoor air quality management programs. So I think it's really appropriate that we begin our conversation about indoor air quality with a spotlight on schools. As Dr. Allen said, every time I hear Dr. Allen speak, it helps me frame the issue even better. And when he talked about the most vulnerable to disruption, if there's anything that we have discovered in this last 3 years of dealing with the pandemic, it is that the disruption that it caused in our schools is something that we cannot, as a society, tolerate, right? That our schools are such important places to the infrastructure of our communities, because we recognized over these last 2.5 years that schools are not just the place that we send people to receive academic instruction. Increasingly, and I'm sure that Dr. Jara and Dr. Marrero can testify to this, increasingly schools are becoming the place where students are receiving everything from their main food and nutrition to their primary health care, their mental care. So many things are happening there. So when we think about, you think about in the public health sector and how schools are a part of public health, really. When you think about in the public health sector, there's been this move towards the patient-centered medical home. And I think of schools really as the student-centered educational home.
Schools are the safest place, and I want to make sure that our students are in schools and our staff are healthy in schools. As I have a saying, that teaching leads to learning. That's not a myth. That's scientific fact as far as I'm concerned. And our students learn best when they're in school. Just like a student won't learn if they're not safe, secure, supported, neither will an educator if they don't feel safe, secure. So we have to do everything in our power to make sure that everybody who's within the confines of our schools and our facilities are safe, secure. And that definition has expanded since the pandemic. Right.
Back when Race to the Top, those of you with President Obama up in his administration, let me give you a couple numbers. Back when we in education, there was a $4 billion investment in K-12 education. We thought that was a lot of money. There's a $122 billion investment in this ARP. What this administration, I would tell you, historically has been the largest investment, and I say investment in our children around K-12. And it's not enough. Not that I'm asking for more, but the reality is that I have, when you talk about facilities and when you talk about our health of our children, I have a $6 billion gap in facility infrastructure.
When you talk about the inequities that we know are there, COVID in so many ways just laid bare so many of the fissures in our society, and that inequity, those inequities being one of them. Last night I was talking to my son about, my 24-year-old, about what I was going to be doing today, and he was like, yeah, indoor air quality, got it. He says, but having gone to public schools all this time, are you going to talk about indoor air equality? And I was like, dude, I'm about to TM that, right? But that's exactly what we're talking about here is, closing those inequity gaps as well, and the challenge that we have there. And I love what you said there, Dr. Jara, about the many hats that you wear, because what we've discovered here too is that in schools, everyone's an educator, everyone is a facility manager, everyone is a healthcare provider, no matter what your role may be right now, everyone is filling all those roles. And so I'm really curious to hear more about the specifics of the interventions that you have taken, the science-based interventions that you've taken in your school districts.
There is a lot of research and evidence, as the last 3 years in particular, that academic performance is tied to building performance. And I've learned that throughout the last couple of years, which is tied to health performance. So that's the tripod: academic, building, and health performance. And if that's going to be the minimum expectation, I'm asking respectfully, allow us to say that this is a non-negotiable, whether it's through some continual funding or through policy. And as Dr. Ja, you mentioned when you opened up, we won't question water quality, right? If we open up a tap and we see something that looks less than translucent, it's brown, we'll go into action or we'll close the school. No ifs, ands, or buts about it. It's like a gas leak. We don't know if that's the case when it comes to air quality. We'll walk into a room unbeknownst to what we're walking into. So if we have the monitoring systems, which we've invested in our school system and in our buildings, and we know when things are less than satisfactory or adequate, then we can close down and mitigate. If that's the expectation, let it be the expectation, because we will never allow a glass of water to be less than pristine.
It's if we really, as a country and as a nation, are focused on improving. We know healthy buildings will produce healthy kids. We've done that. I'll use a different analogy and say, well, it's not just the water, right? I mean, we're looking at our food and what we feed our kids. So how are we monitoring systemically the air quality that our children and our teachers? Because I don't want to just say that it's not just our kids, it's our educators. They're healthy educators. So you start so we have to get something that we're starting to look at, in some of the research, but it's one of the things that we need to get better at.
So this is a great launching point for a conversation around what you brought up there, Dr. Marrero, the tripod. We call it the three-legged stool of indoor environmental health in schools. There's so much of a focus on the school facility, but really it is that focus on the school facility is because of the impact that indoor air quality and environmental health has on health outcomes and academic performance. And if you don't believe me, go read Dr. Allen's work, right? We have the data. We've got the data to prove it. And so when you talk about, Dr. Jara, your conversations with your chief financial officer, one of the things that becomes important, I think, is how we do exactly what you've been saying, how we create parity between the way that our school buildings function with the product of the school building, with the educational performance, and that connection being the health outcomes. And the more we improve health outcomes, the better we have, the better attendance is, the better our learning outcomes are, because that learning loss you don't recoup. So when you talk about funding and policy, talk to us a little bit too, we know that every school district is different, every school building is different. However, when you think about talking to your peers out there about putting in place lasting funding sources and lasting policy at the district level, when we talked earlier, Dr. Marrero, you talked about the connection that you now have and the understanding that's happening at the school board that helps create those kind of champions. Talk to us a little bit about the advice that you would give to other school districts about, at the district level, how you continue to create this priority for indoor air quality that connects it to health outcomes, academic outcomes, and at the end of the day, bottom line, financial outcomes.
In addition to that, we all are familiar with dashboards. Some people love them, some people don't. They're controversial. So whether they're academic dashboard, an equity dashboard, we're looking to have an air quality dashboard, right? So maybe it's just a portion of an overall dashboard. So when you're deciding what school you're going to go visit or even enroll, you'll have a snapshot of what we're able to gather, right? So we don't have that yet. We're planning for that in the near future. Hopefully we'll have something up before the end of the school year.
And if I can add, because I think it's critical to also discuss and look at how we monitor, right? I mean, I think the dashboard just brought me to something that we do as we're growing, not only within our facilities department and our facilities unit, also our environmental services, right? It's really thinking about our workforce, thinking about our health of our employees, right? And then also our students. We're measured, those of you who may not know, in K-12 education, we're measured as part of our accountability on chronic absenteeism, right? So it's just, well, if kids are sick, you know, we've gone through COVID, right? We told them to stay home, right? But now as we're bringing them back, it's what's that environment and that healthy environment. So my board of trustees is really very supportive of this work at the local level in policy.
You know, when you talk about where you're headed and where you've been, it definitely is reflective of what we see in the larger picture for school districts across the country, and the things that you've spoken to here in terms of policy and funding and technical support. You know, it really reflects, you know, what I've seen kind of surfacing. I'll call it the 3 A's, right? It is, in response to COVID, it has been increased access to resources, right? That has shown up. But it's also been an increase in school districts' ability to take action on indoor quality because of the guidance that's gone out, because of the technical assistance, and needing more of that in a sustained way that makes the action possible, right? Two of the key drivers there are around a couple of things that you were talking about, and I want us to, you know, as we start to close, to be talking about these because I think that they really are critical. One of them is around evaluation, right? And you started to talk about what you're monitoring, what you're measuring, how you are determining that the interventions that you have are successful, because, and then how you are communicating that internally and externally, because that is the thing that builds the confidence and the trust that leads to more funding, that elevates the issue, that brings all of those things to the fore. And so I would love if you could, you know, kind of share the impact that your indoor air quality interventions and improvements have been having on your students and staff, you know, kind of, and what it is you're looking for in terms of measuring your success, how you're communicating that, you know, with folks so that it does stay sustainable. So, you know, you talked about the dashboard and that being a forward-facing thing. How are you using the data? How are you using the metrics? How are you communicating that? And what do you need help with?
So I want to put that out there. I'm sure there's others who are struggling, just like we are. But we've done an incredible reaction and response, I should say, to everything that was COVID and our new norm now. When it comes to evaluation, the truth of the matter is there is nothing holding us accountable to doing this, and that's the scary part. So I want to just let that simmer for a second, because anyone can avoid this, right? There are competing priorities. When it comes to test scores, when it comes to everything else that you can imagine, are things that we're held responsible for. So if it doesn't happen at the federal level, then locally, it's a value statement for a Board of Education or Board of Trustees to say, okay, this is important to us. Thankfully, that's what my board has done, right? So now it does become an evaluation measure for Denver Public Schools, which I represent as superintendent. In terms of the dashboard and what we're looking for and what we've seen thus far is increased attendance, and I can't stress that enough. You know, being in school matters. Right? This is not the lotto. You have to be in it to win it. You have to be in there. The more, the merrier. And also, when it comes to our survey results, something that we are prioritizing is self and welcoming environments, and that's just for our students and for our staff. And we've seen some response, and of course, it's coming from COVID. So if that was our baseline, then that's the absolute bottom of the barrel when it comes to how folks were feeling. But we have seen an incline on reception and being a part of the learning community. So when it comes to self and welcoming survey qualitative results and quantitative in terms of attendance, and not for students, our staff attendance as well. And there is a tremendous teacher shortage, right? So that one absence means a tremendous amount, because one absence when you have a couple of vacancies in the school building can easily become an operational closure of that entire school, which means everybody misses out on the day of learning.
You heard Dr. John this morning talking about the moment that we're in, and Dr. Allen talking about how it is becoming a movement. And it absolutely is. COVID has brought us this moment. And because of the actions of school districts like you see before you right now, it has become a movement towards indoor air quality. But we have this opportunity right now to take this moment that is becoming a movement and turn it into a monument for environmental health and improved indoor air quality, improved health for students and staff in our country forever and ever. Amen. And so that is what I would invite you to do, following the example of these fine gentlemen. And so,
safe building is not enough. It's also a trust issue. In addition to a dramatic health crisis and dramatic economic crisis, we also have a trust in the institute crisis. And one of the institute that people still trust is their employer. And we thought that this is our responsibility to communicate and to make sure that everyone is safe, but also feels safe. And doing that not by doing COVID theater with people wearing white in the lobby and thermometers, but providing a radical transparency to everything that we are doing. And that's allow us to do something very, very simple, to translate the building data, the physical attribute of each room with the air ventilation, with the mask policy, and give a single number between 1 to 100, which is what's your infection risk in each room. And based on that, we create a software that was very easy to understand using color coding when you enter a room. It's enable the people in the room to understand whether they should wear a mask, what's the different effect of different masks. It's enable us as a facility team to upgrade using a portable HEPA filter certain areas that were not safe. Very similar to the fact that we have sprinklers and fire exit. We also need to make sure that we have good air ventilation and people are not getting infected in our offices.
If you think your building is operating the way it's designed to operate, it's not. We find that building managers definitely want to do the right thing, but they don't know what the right thing is.
To make it seamless. The beauty of the air filtration and air ventilation is that you, as an employee, don't need to do anything. It's a magic that happens behind the scene.
There's lots of evidence, Dr. Allen among them, that show that increased ventilation and indoor air quality makes people think better, or that is to say, doesn't inhibit their thinking. That's probably a better way to put it. The other thing that's surprising is if you do these things that we're talking about, 9 times out of 10, we find that once you tune up the building, you save more money on building operations than you're costing doing this work anyway. So you're going to save money, bottom line kind of money, and still have a safer building for people to work in.
In Dubai, in which it is desert weather and the air being recycled again and again in order to conserve energy, there was a high level of CO2. So we did an A/B test on second grades. On one classroom, they didn't change the air. On the other classroom, they improved the air quality, and they find out that the student average that being tested every week was 10 points higher when the CO2 level was lower.
Improving indoor air quality will do more than just reduce SARS-CoV-2 transmission, influenza transmission, but we know there's reduced absenteeism, there's better performance in schools, people are more awake at work, and they will live longer as a result. It's well worth it.
Same thing is true with schools across the country. The lower income communities are more likely to have older schools and schools with less sophisticated HVAC systems.
We've kind of layered on equity in these conversations and in the prior panels. When I think of this kind of question and this challenge that we have, wealth and privilege shouldn't be, the reason that you have access to proper health, quality air. The town, the neighborhood, the community that you live in shouldn't dictate whether you have access to healthy spaces to live, work, eat, sleep, and educate in.
You really need to be aware that some of the cleaning products that you use might be irritants for folks who are returning back to work. You have to be careful about some of the air purifiers that you're using or cleaners, because some of them can throw off ozone. And
each reflect on, are there investments in particular, or are there places or partnerships that you would point to as opportunities for us to replicate in the future, or as places for our audience, both here in the building, but also online, to look to as they're desiring to act in this area?
A group of us have been organizing a National Academies workshops, a series really on indoor air management for airborne pathogens and other pollutants. And we've seen some case studies of scientists partnering with local school districts. And that's, I think those are some good examples to look to. I also want to point out some resources that I thought were particularly effective from the Seattle-King County Public Health Group, where they offered kind of indoor air quality consulting assistance for anybody who reached out to them, and also set up a program to loan out portable air cleaners.
And then I think collaboration is one of the biggest things, as what everyone's always said. I know that what we've been doing is really collaborating across sectors, public, private, stakeholders, as well as other nonprofits to really start having those conversations and educate the community as the best that we can on the kind of impacts and the cost. I would say like really on the cost of inaction versus the cost of doing it now, so that because when you invest now, it helps the private sector, it helps businesses, it helps workforce, it helps the educators. But if you wait, it's just going to be ongoing. Your emergency rooms, the homelessness, other kind of challenges that come with living in places that are not healthy. Really burdens our systems and our services and our community.
What does the future of clean indoor air look like? And how can we get there with innovation in IAQ technologies and tools? So let's start with Dr. Corsi.
I think if we get there, and we have the tools to do it now, but if we get to that place, we'll see reduced workplace absences, we'll see reduced absences of teachers and students in schools, we'll see a tremendous economic return on investment. One of my students has done some work in this area. Lindsay mentioned 10-to-1 benefit to cost ratio for improving indoor air quality in schools. We found the same thing for about 12 different cities in the United States. And I hope we'll get there, keeping in mind the need to employ technology for the greater good of all society, that we leave no community behind. I think everybody in this room can probably afford a really good HEPA air cleaner in their home, but a large swath of America cannot. It lives paycheck by paycheck. So we have to be thinking about accessible technologies for all.
The point about awareness and raising awareness, it's been made several times today, and as it should. And of course, what's implicit in the value of increased awareness is change in behavior. And Dr. Miller just mentioned a consumer choice preference decision difference that might come from greater awareness. But it applies to all other contexts of the built environment as well. For instance, a step that we should be taking as people like us should be walking around with one of these, a portable indoor air quality monitor. How many of those are in the room here? I see several. Okay. And we see that the CO2 concentration in this room is hovering around 1,200, 11, 13, which isn't great. It's consistent with the legacy standards of our industry, as Dr. Allen pointed out, the ASHRAE standard, but it's certainly subpar about where we need to go. So all of us asking those questions of the providers of the built environment that we consume is essential. And I say that because in my observation, many years on the private sector in this industry, I've observed that the real estate industry as a free market, is quite efficient. And it does match supply to demand quite readily. And so if the users, people like us, are asking questions and requiring more of the built environment, the industry is able to respond. And I believe it will. So I'm optimistic about this, to the theme of if we are successful in raising awareness. The see something, do something mantra that we all live with now, post 9/11. We need the equivalent for this moment in time, which, as we have also discussed, won't last forever, about this topic of air quality.
Great. Mr. Cho, just want to turn to you about the sensors. You kind of spoke to it a little bit earlier, that there's some innovations and different aspects of sensors for integration and data democratization. Just wanted to see if you had anything to expand on that point.
Yes, the sensor that what we've been so far experienced, that is digital sensor is so much cheaper than last 10 years, got really price reduced than electrochemical sensor, which we used to have. It does usually require the periodic calibration, like old sensors, and it does also skew data, and it's got a lifespan is much shorter. But the digital sensor now is what is available in the market. It really is semiconductor sensor. And pretty much we don't need any kind of a calibration, and much cheaper, and easy to access, and easy to manufacture. So the building those sensors is in general is relatively easy in terms of like a startup point of view, and price-wise also very reasonable. However, installation is hard because a lot of technology part that has to go, right? So what we experience here is installation, meaning like for enterprise, most of them is retrofit. And when they need to connect to the sensor network to their building management system, basically it's not available right now, unless you want to really put the latest system in place, completely make over the system of a building. So what we need to focus now is the connectivity, how we can lower that barrier. Also, we can connect those sensors to the system easily. That's where we are currently focusing.
Yeah, the easy answer to that is we have the perfect storm, and if not now, when, right? This is the time the public has suddenly tuned into indoor air quality. 3 years ago, you didn't hear as many people in the general public talking about HEPA and MERV and CO2 and so on and so forth. So it's becoming part of the American lexicon, I think, which is important. Certainly employers recognize the importance of indoor air quality from a bottom line standpoint. School districts across the country understand it from keeping kids in school and keeping teachers in the classroom and not being sick. And I think government recognizes it. So, we have everything we need. All the ingredients are in this soup to move now. The time is a perfect time.
I think during a crisis, transformational usually, right? I want to repeat it again. Data is really important because we need to have data to see what happened. So for now, I think it's a really good time for us to place the system so we can continue collecting the data. If this kind of like a pandemic, who knows, outbreak happened, then we got something we can go to see what happened and think we have a track record. So I think we have to do it now.
You cannot understand how much money we're going to save in terms of healthcare costs and productivity. And people will actually understand that now, that oh, that's right, if we maintain a healthy indoor environment, we're going to save money on asthma, on infectious diseases, on sick building syndrome, and on productivity. So I think that we just really need to, I just can't quite see how to get there from here, but I know there's a lot of smart people working on this problem, and I'm ready to help.
So let me lead by saying we've talked a lot today about schools. I don't think we've talked about education, and I think that's really important. I think we need to start infusing aspects of indoor air quality into high school chemistry courses and physics courses and biology courses, into high school science courses. Shelley and Lindsay, how many universities right now have a course on indoor air quality at the undergraduate level?
3.
Maybe 3 in the whole country. So we're not even teaching it at the university level. I'm teaching a first-year seminar, a freshman course at UC Davis this term on indoor air quality. And there's one engineer in the course. The other 19 students are all from animal science and economics and English and political science. And it's amazing to see their eyes open up as they learn some of the things that they hear that they've never heard before regarding the importance of indoor air quality, how to improve indoor air quality in their dorm rooms. These are all freshmen, so they all live in the dorms. It's been a great experience, but I think we need more of that, and we need more professional certification courses to educate people that have already graduated or haven't gone to college. And I think we need to keep thinking about ways to innovate. So I'm going to just throw one idea at you as we depart, and that is ceiling fans. Simple, low energy devices that bring a lot of air to them and that have characteristics we call sort of very good at mass transfer between air and the surface of the fans. I had a student about 12 years ago who made some activated carbon sleeves to put on a ceiling fan in our test house at the University of Texas at Austin. We found dramatic reductions in indoor ozone levels when we did that relative to just a ceiling fan operating with no activated carbon sleeves on it. Activated carbon cloth is extremely cheap now. cost about $6 or $7 to put a sleeve over every single fan blade. Probably need to be replaced on the order of every 3 months or so. So we're looking at $25 a year for removing a lot of ozone, as well as volatile organic compounds, as well as some semi-volatile organic compounds. You know, we have things in front of us, and we have existing technologies that we can use if we want to innovate to significantly improve indoor air quality at low energy penalty and relatively low cost. And we should be always thinking about how we can do those things. There's things we're not doing now that we can do that would be helpful to occupants of buildings.